Hola, muy buenos días a todos. En un minuto, en breve, ya estamos comenzando con esta sesión. Vamos a esperar un minuto más a que ingresen otros periodistas en la sala y ya comenzamos. Gracias. Ahora sí, entonces, ¿qué tal? Muy buenos días a todos desde Washington, D.C. Gracias por conectarse a esta sesión informativa de la Organización Panamericana de la Salud sobre la pandemia por COVID-19 en la región de las Américas este miércoles 10 de marzo. Soy Sebastián Oliel del Departamento de Comunicación de la OPS y como todas las semanas esta sesión durará alrededor de una hora. Estaremos tomando preguntas de ustedes hasta ese momento. Ya hemos recibido preguntas por correo electrónico y también podrán hacer sus preguntas en vivo y a través del chat mediante el botón Q y A. Recuerden siempre, por favor, incluir su nombre y el medio de comunicación al enviarnos sus preguntas. También les recuerdo que contamos con interpretación simultánea al inglés, portugués y francés y que pueden optar por cualquiera de ellas dando clic en el botón Interpretation. Hoy la directora de la OPS, la doctora Carissa Etienne, les informará sobre la situación epidemiológica actual de la pandemia en las Américas y dará una actualización sobre la situación de la vacunación y las vacunas y sobre el rol de la OPS y su fondo rotatorio en la adquisición y envío de vacunas a la región como parte del mecanismo COVAX. Hoy acompañan a la doctora Etienne en esta sesión, el doctor Jarbas Barbosa, subdirector de la OPS, y el doctor Silván Aldiguieri, gerente de incidentes para COVID-19 en la OPS. Ahora sí, entonces quisiera invitar a la doctora Etienne para que comparta sus palabras. Doctora Etienne.
Thank you, Sebastian. Good morning, and thank you for joining today's press briefing. As of this week, the Americas have been home to nearly 52 million cases and more than 1.2 million deaths from COVID-19, with more than 1 million of these cases reported in the last week alone. The United States, Canada, and Mexico are continuing to report a drop in new infections despite localized hotspots in the US, the state of Virginia, and Nunavut in Canada's Northern Territories, which is home to many indigenous peoples. Across Central America, countries are experiencing a decline in infections, although areas of Guatemala and Panama's indigenous province of Gunayala are reporting an increase in cases. In the Caribbean, larger islands are continuing to see a drop in cases, while Cuba, the Bahamas, St. Lucia, and Guadeloupe are seeing a rise in infections. In South America, Paraguay, Uruguay, and Chile are reporting an increase in new cases. And while Peru and Bolivia are finally seeing declines, infections remain high. Cases are on the rise in nearly every Brazilian state. And over the last week, the country reported its second highest rate of infections and its deadliest day since the pandemic began, with 1,910 COVID-related deaths reported in just 24 hours. The Brazilian state of the Amazonas has been especially hard hit. A new variant first discovered late last year has led to a surge in new infections that have overwhelmed the healthcare system, which continues to experience widespread shortages of medical supplies, including oxygen. We are concerned about the situation in Brazil, and it provides a sober reminder of the threat of resurgence. Areas hit hard by the virus in the past are still vulnerable to infection today. And that's why it's important to continue to monitor the virus and to let data guide our actions. But we also cannot wait until our health systems are overwhelmed to implement public health measures. We must rely on these measures early and often to protect lives and our health systems. The situation with vaccines. I am happy to report that vaccinations continue across our region. More than 113 million people have received a COVID vaccine in the Americas as of this week, and more people are being vaccinated every day. Over the weekend, the Bahamas welcomed its first COVID-19 vaccines thanks to a donation of 20,000 doses of the AstraZeneca vaccine from the government of India. Peru has also received its first shipment of the Pfizer vaccines through COVAX. And last week, Colombia became the first country in Latin America to receive vaccines via the COVAX mechanism. Today, these doses are being delivered to at-risk groups, including indigenous communities in the country's Amazon region. Every country participating in COVAX has been informed about the number of doses that they will be receiving through May of this year. We've been very pleased with how quickly countries in our region have responded to COVAX agreements so they can begin to receive the 28.7 million doses that have been allocated to the Americas over the next 3 months. Over the last week, our revolving fund has been working closely with member states to accelerate access to COVID vaccines. For over 40 years, the PAHO revolving fund has helped the countries of the Americas protect people and reduce deaths from vaccine-preventable diseases, including polio, measles, yellow fever, bacterial pneumonia, influenza, rotavirus, and human papillomavirus. Through the revolving fund, 41 countries and territories in the Americas have been able to pool their resources to purchase high-quality vaccines, syringes, and related supplies for their populations at the lowest price than they would receive on their own. This is solidarity among the Americas at its height. Our revolving fund represents the Americas within COVAX, and over the past week, our fund has been receiving country advance payments, signed agreements with manufacturers, and have placed orders on behalf of our member states and begun all the necessary preparations to deliver doses across our region. In those cases where bridge funding is required to access on a timely basis to COVID-19 vaccines, the revolving fund is working with countries to extend financial credits to facilitate the procurement process. Thanks to our collective efforts, nearly 2.3 million COVAX doses will arrive in at least 7 countries in our region in the next days and weeks, and other countries are not far behind. The challenge now is to continue to accelerate deliveries to those countries that have not yet received COVAX doses to ensure that this month that all countries receive their initial installments of vaccines. PAHO is not just focused, however, on delivering these first few doses. We are also looking ahead to what will it take to ensure that everyone in our region is protected and provided as much information as possible on the timing of allocated doses for April, May, and beyond. To accompany the delivery of vaccines, the organization is accelerating the procurement of syringes, personal and protection equipment to ensure that health workers across the Americas have the supplies they need to safely deliver COVID vaccines for months to come. Of course, it's encouraging that vaccines have started to arrive across our region. But because doses are limited, most people will still have to wait several months before they're vaccinated. And during this time, we must remain cautious and protect ourselves, our families, by continuing to rely on the public health measures that have kept us safe through the worst surges of the pandemic. The actions we take will determine how quickly the virus continues to spread, so we cannot let our guard down, certainly not now when vaccines are so close. PAHO is doing its part to help countries secure and deliver vaccines safely and as quickly as possible. But manufacturing limitations, low supply, and high demand for vaccines make this an uncertain situation. In the meantime, however, we need everyone to collaborate as we work to keep ourselves, our families, and our communities safe. Thanks.
Muchas gracias, doctora Etienne. Vamos a pasar ahora a las preguntas que nos han enviado por correo, también por el QIA y en vivo. Recuerden escribirnos sus preguntas en el QIA e incluir su nombre y su medio de comunicación. Varias preguntas de varias periodistas, Jacqueline Vileda de El Mundo, Milagros Barrios de La República en Perú, Mariana de Barrios de Venezuela TV. Ellas preguntan si podríamos brindar más detalles sobre los países que estarán recibiendo vacunas a través de COVAX próximamente. Doctora Etienne.
Thank you for that question, which is a much asked question indeed. PAHO's revolving fund and our procurement teams are working hard to ensure that the countries of the Americas receive as many vaccines as they have been allocated and as quickly as possible. So in the next few days, we know that Honduras will be receiving some 48,000 doses of AstraZeneca vaccines, and El Salvador is also due to get some 33,600 doses from the same manufacturer, SK Bio. Guatemala will receive some 81,600 doses of the AstraZeneca vaccine, and Jamaica will also receive doses of the AstraZeneca vaccine. We have also placed orders from Serum Institute of India for 135,000 doses of the AstraZeneca vaccine for Nicaragua and 228,000 doses for Bolivia. But more vaccines will be arriving in coming weeks, and we will be moving to ensure access to vaccines for all of the countries that are participating in the COVAX mechanism.
Thank you, Dr. Etienne. La siguiente pregunta en inglés es de Kadim Joseph, Health Editor at Observer Media en Antigua y Barbuda. Y dice, how does PAHO project the dissemination of vaccines will affect the return to some semblance of normality in the Americas, considering the impact of vaccinations on the transmissibility of COVID-19 and the questions about how long immunity will last after a vaccine is administered? Dr. Barbosa?
Thank you. Thank you for this question. It's very important, as our director has already highlighted, to understand that the vaccines will take some time to work to control the transmission. First, because most vaccines that are being used requires 2 doses. So the people will get immunized after the second dose, after 2 weeks, probably, or a little bit more after the second dose. So this will get some time to get people really immunized against the COVID-19. Second, it's expected that we need to have at least 70% of the population vaccinated in order to achieve the herd immunity that is necessary to control the transmission. For this reason, when you see even countries in Europe that have already vaccinated the 12, 15, 18% of their population with the first dose, most of them are adopting very strict public health measures to avoid the increase in the transmission, to avoid the intensive care units to be overwhelmed and other very important health impacts produced by COVID-19. So while we are trying to get more access to vaccines, it's important to understand that the first objective of the vaccine now is to save lives. For this reason, the most vulnerable groups need to be vaccinated first in order to decrease the mortality. But we can only think to becoming to normality when the transmission is fully controlled. So we need to keep all the public health measures, wearing masks, keeping physical distancing, avoiding closed and crowded spaces, and all the measures that we know and we have evidence that can protect against the transmission. About the duration of the immunity, we still need to have more data about this. When we are talking about vaccines, they work differently. So we'll need to get more data after 1 year, what is happening with the protection provided. So the producers are working to get this data in order to have a future recommendation about a boost, a third doses, all the recommendations that will be carefully reviewed by the SAGE, the Strategic Advisory Group on Immunization of WHO, and our Technical Advisory Group of the Pan American Health Organization to provide this kind of guidance. We will need more data, and this data will be reviewed very carefully to make the proper recommendation when the time comes. Thank you.
Gracias, doctor. Una segunda pregunta de Kadim Joseph. Pregunta si, en inglés, perdón. Have there been any updates on treatment regimens for critically ill patients? Dr. Aldiguieri.
Yes, thank you for this second question from Antigua and Barbuda. First, I'd like to highlight that Antigua and Barbuda is reporting on a daily basis its cases and deaths as required under the international health regulations. So it's an important point. On our side, what PAHO is doing, PAHO is updating on a regular basis the review of potential new treatments that are published in peer-reviewed publications following randomized clinical protocols. This live review is published on the PAHO webpage, and it's accessible to all clinicians and ministries of health and scientific societies for their use. The recommendations for clinical management of patients with COVID-19 have not evolved drastically during the last couple of months. I'd like to highlight some of this recommendation as the close follow-up of persons with risk factors, including comorbidities, the monitoring of the oxygen level in patients suspected or confirmed to have COVID-19, and the detection of any evolution of the clinical status of the patients that would trigger a transfer to an intensive care unit. The timely access to oxygen therapy is key for preventing respiratory complications, and the use of anticoagulants and the dexamethasone has proven to be effective for reducing the mortality in critical patients. So I hope I have answered some of the concerns of our colleague from Antigua and Barbuda. Thank you.
Muchas gracias, doctor. Ahora quisiera darle la palabra a Gisela Salomón de la agencia AP para que haga su pregunta. Gisela, si nos estás escuchando, adelante.
Sí, ¿me escuchan?
Sí.
Gracias, Sebastián. Yo quería hacer una pregunta con respecto a Chile. ¿A qué se debe el éxito de la vacunación en Chile? ¿Hay alguna razón específica por la que Chile se diferencia en la vacunación de los otros países de América Latina?
Gracias, Gisela. Doctor Barbosa, ¿podría contestar?
Gracias por la pregunta, Gisela. Gisela, la situación de los países en la región de América Latina y el Caribe son muy distintas. Chile é um país de alto ingresso, outros países são países de baixo ingresso. Ou seja, Chile, eu creio que teve dois fatores importantes. Primeiro, seguro que teve uma boa planificação e utilizou de uma maneira inteligente os recursos que tem para fazer acordos bilaterais com alguns produtores. Ademais, Chile também é participante de COVAX, ou seja, manteve várias opções de ter acesso à vacuna. Pero não creio que essas mesmas condições se puderam aplicar em outros países da região que não têm os recursos como Chile, porque não são países de alto ingresso. Assim que, por esse motivo, que cremos que para todos os países da região, tem que tomar suas decisões de acordo com os recursos que tenham disponíveis. Se tem os recursos para fazer acordos bilaterais, muitos países lo fizeram, e também participar em COVAX, porque COVAX vai brindar uma maneira acessível para todos os países. Há 10 países de nossa região que não têm recursos para fazer nenhum acordo bilateral. Esses países, se não for COVAX, provável que iam tomar meses ou anos para ter acesso às vacinas. Esses países vão receber a vacuna por intermédio de COVAX sem necessidade de pagar. Esse é um avanço muito importante para a região. Então, todos os países têm suas fortalezas, suas condições. A OPS está apoiando a todos os países para fortalecer seus programas de imunizações, para estar listo para receber e começar a utilizar a vacuna de uma maneira importante em la região. Muchas gracias.
Gracias, doctor. Siguiente pregunta en inglés viene de Jacqueline Charles del Miami Herald. Dice, it was recently announced in the Caribbean press that Venezuela donated $200,000 to Grenada for COVID-19 vaccine. This, of course, has created confusion given the ongoing discussions about Venezuela and COVAX. And she's asking, has Venezuela made its down payment? How much exactly is required? What is the real issue, and what is your reaction to this news that it has given $200,000 to one country while others are trying to help it get vaccine access? Dr. Barbosa?
Thank you for this question. I understand that this donation from Venezuela to Grenada is a bilateral agreement among two countries that the PAHO is not participating. This is a sovereign decision from each country, and we also welcome solidarity. It's important that the countries that can make donations to other countries, donations of vaccines, donations of money to support them to strengthen their immunization. I think that all these actions are always welcome, because this is part of the solidarity among the countries in the region. Venezuela has not made yet the down payment to COVAX. It's around $18 million. We are working both with COVAX, and the PAHO is participating in negotiations in Venezuela. These negotiations are progressing very well, but it probably will take a couple of weeks to finalize them and to have some currently frozen funds from Venezuela able to be used to pay this down payment, so Venezuela can be included in the second deployment of COVAX vaccines. Thank you.
Muchas gracias, doctor. Tenemos la siguiente pregunta en inglés sobre un reporte de ECLAC. La pregunta dice, ECLAC recently reported that extreme poverty in Latin America reached levels in 2020 not seen in the last 20 years. Why did the pandemic have such a devastating economic impact on our region? And is there anything we could have done to lessen that impact? Dr. Etienne, could you take this question?
So thank you, and certainly let me acknowledge the critical work that ECLAC is doing in our region. And we have had the opportunity to work with them on several occasions. So when we think about the big picture impacts of COVID-19 pandemic on our region, There are two critical points that I want to make and that I think we should keep in mind as we look forward towards recovery and importantly, as we prepare for future pandemics. The first is that COVID-19 exposed the interdependency between health, society, and our economies. We've made that point several times. It is important to note that economic growth is built by a healthy population, and health outcomes are intrinsically linked to the strength of economies. COVID-19 ushered in a triple crisis: health, economic, and social. Some people say political as well. And this crisis ravaged our already weakened health systems, destabilized economies, and fractured social protection. So moving forward, we must seek to integrate our approach to health, social protection, and the economy, and in doing so to mitigate the impact of shocks from major health events like COVID-19. The second point that I'd like to make is that the deeply entrenched inequality in our region made the impact of the pandemic even worse. COVID-19 disproportionately affected the poor, the elderly, and those with underlying health conditions, and other groups that live in conditions of vulnerability with limited access to the social determinants, including healthcare. To effectively cope with health threats like COVID-19, we must focus on reducing inequalities, on eradicating poverty, and strengthening social protection and health systems, and really increasing the access to healthcare for everyone, regardless of who they are or where they live. This will not only bring us closer to realizing our vision of universal health or health for all, but it will accelerate economic growth and build more resilient societies that are better equipped to confront the next pandemic. And this is extremely important. We must prepare now that we can more successfully confront the next pandemic. Over.
Muchas gracias, doctora Etienne. La siguiente pregunta es de Rodrigo Rosales, del diario Expreso de Perú. Dice, respecto a la vacunación, ¿qué países precisamente han avanzado aceleradamente con su proceso de inoculación? Producto de esto, ¿hay estudios que apunten que sus ciudadanos efectivamente han logrado la inmunización? Y también pregunta si existen, según sus indicadores en la región, casos en los cuales haya personas que han presentado efectos negativos severos. Doctor Barbosa.
Gracias por las preguntas. Los países de la región están avanzando con la vacunación, pero como todos sabemos, el acceso es todavía muy limitado y va a seguir limitado por un par de semanas o meses. Entonces, es muy importante garantizar que cada país pueda tener sus grupos prioritarios vacunados, que las personas más vulnerables para tener la enfermedad o para desarrollar formas graves puedan ser vacunados, o sea, utilizar da mejor manera posible la vacuna que está disponible. Entonces, todos los países están vacunando de manera relacionada com a disponibilidade de vacunas que têm. Como percentagem da população, temos em la região, Estados Unidos, a Chile, os territórios de Reino Unido, que estão avançando já muito com a vacinação, quando comparado com outros países. É importante subrayar que estamos falando da primeira dose, ou seja, para a grande maioria dos dados, não temos todavia quantas pessoas já completaram com a segunda dose em cada país. A Organização Pan-Americana de la Salud, estamos recorrendo a informações de todos os países que vão ser atualizadas todas as semanas e vamos a ter tablero com as informações para cada país, para que seja possível acompanhar, monitorear todos os avanços que se estão haciendo nesse tema. Né? Seguro que a vacuna também já temos bastante informação, porque já são mais de 200 milhões de doses aplicadas no mundo. As vacunas que se estão utilizando, e especificamente as vacunas que são pré-calificadas ou que têm autorização de uso de emergência da Organização Mundial de Saúde, han demonstrado que são vacunas muito seguras hasta agora. Não há casos de efeitos adversos graves relacionados com essas vacunas. Os efeitos adversos são leves e são muito semelhantes com todas as outras vacunas. Ou seja, que a pessoa pode apresentar um pouco de dolor no local de vacunação, pode ter um pouco de mal-estar, nas horas depois, um dia, 2 depois, mas todo isso se passa sem necessidade de ajuda médica, como ocorre também com outras vacunas. Então, agora temos muitos dados para assegurar que as vacunas são efetivamente seguras. Os dados sobre a eficiência das vacunas, alguns países, eu creio que já começam a ter alguns dados, principalmente Israel, que é o país que mais ha vacunado no mundo, como porcentagem de sua população. E já se pode também, em outros países, como o Reino Unido, verificar o efeito positivo da vacuna em la redução do número de hospitalizações. São dados preliminares, pero que estão de acordo com os resultados de eficácia que essas vacunas apresentaram para solicitar sua autorização de uso. Então, são vacunas seguras e eficazes. As vacunas que vão a ser fornecidas por el mecanismo COVAX são vacunas que sempre têm que ser pré-calificadas ou ter a autorização de uso em emergência da Organização Mundial de Saúde. Essa é uma garantia a mais sobre a segurança e a eficácia dessas vacunas. Gracias.
Muchas gracias, doctor. La próxima pregunta viene de Sara Teófilo, de Correio Brasiliense, en Brasil, y dice en inglés, Brazil is experiencing its worst moment of the pandemic. Is lockdown the solution in a national collapse scenario? Dr. Aldighieri?
Thank you for this question from Brazil. This is a topic that we have covered last week during the previous Pan American Health Organization press conference. And we'll try to address the concerns of the journalist. As of yesterday, 9th March, Brazil has reported more than 1 million cases of COVID-19, including more than 266,000 deaths. This is the second country of the region in terms of reports after the United States. And as I said, as commented during the PAHO press conference last week, we have received reports from the Ministry of Health and from the states of Brazil of high incidence of cases, increase in terms of ICU beds admissions, and increase in death countrywide. This phenomenon has been observed in most of the regions of Brazil, including in the Northeast, Nordeste, the Midwest, and the South. 12 states during the last 2 weeks are reporting ICU occupancy rate superior to 85%. There are very few exceptions for these increasing nationwide trends. And these exceptions includes the states of Amazonas and Roraima. But these states were highly impacted by the second wave in January and February, and they are now reporting decreasing trends in terms of new cases and death. So Brazil is a large country with a large populations, and the patterns can be quite different from a state to another, and also from a municipality to another. In this context of nationwide increasing trends, PAHO strongly recommends the implementation of public health measures, the very strict implementation of public health measures. And we are confident that the health authorities would strictly implement them, monitor them, and assess them. These public health measures have proven to be effective to curb transmission in similar contexts. So I hope that I have answered the concerns of the journalists. Thank you.
Muchas gracias, doctor. Quisiera pasar a una pregunta en vivo con Melina Ochoa, reportera de UNO TV en México. Melina, si nos estás escuchando, te doy la palabra.
Hola, ¿qué tal? Muy buenos días. ¿Me escuchan?
Sí, buenos días, adelante.
Así es, Melina Ochoa, reportera de UNO TV en la Ciudad de México. En México, 8 estados reportaron que la vacuna china Sinovac llegó con una temperatura 3 grados más elevada de lo recomendado. Esto puede echar a perder una vacuna. ¿Qué recomienda la OPS respecto al manejo de vacunas? Y una segunda pregunta sería, ¿la OPS considera que habrá un tercer incremento de contagios o tercera ola de COVID-19 a raíz de las vacaciones de primavera, Spring Break, o como lo llaman en México, Semana Santa? Gracias.
Gracias, Melina. Doctor Barbosa, ¿podría contestar?
Gracias, Melina, por las preguntas. Mira, la vacuna de Sinovac que está ahora en México no es una vacuna fornecida por el mecanismo COVAX. El productor de la vacuna, Coronavac, que es el productor Sinovac, está en conversaciones con la OMS para brindar las informaciones necesarias para que esta vacuna pueda ser evaluada y se decidir sobre la autorización de uso de emergencia. Pero todavía no es. Entonces, que essa vacuna está llegando a México por intermedio de un acuerdo bilateral que tiene el gobierno de México. Así que seguro que la Secretaría de Salud de México y la Autoridad Regulatoria de México, COFEPRIS, deben tener todas las informaciones del productor para poder evaluar isso que se chama excursão de temperatura. Os produtores, quando produzem a vacuna, fazem muitos testes e esses testes incluem a possibilidade de que a vacuna se vá pouco por allá de la vacuna recomendada. Isso tem uma variação para cada vacuna. Algumas vacunas têm mais estabilidade que outras vacunas, porque estamos falando de produtos diferentes, que têm uma plataforma tecnológica muito diferente uma das outras. Assim que essa informação quem pode brindar de maneira idônea é a Secretaria de Saúde de México e COFEPRIS, porque têm as informações do produtor de essa vacuna. De toda sorte, aproveito para subrayar também a importância de que todos os países possam revisar sua cadena de frio, incluindo os meios de transporte das vacunas. A OPS está trabalhando com os países em la evaluação das cadenas de frio, porque essa é parte importante de uma ação de imunização. Sobre a possibilidade de terceira ola, sim. Desafortunadamente, enquanto o vírus está circulando, enquanto há transmissão, todas as vezes que se barra a guarda e se tem pessoas salindo às calles sem utilizar cobre-bocas ou mascarilhas, pessoas que estão se aglomerando, pessoas que estão em lugares cerrados, isso sim pode passar de ter um incremento da transmissão. Por isso é muito importante durante a Semana Santa, ou as vacações de primavera, que as pessoas possam seguir mantendo todas as medidas. O vírus está em todos os países, o vírus está circulando, ou seja, o risco de se infectar e de desenvolver a enfermidade é muito importante. Então, há que manter todas as medidas para evitar que se tenha esse incremento de transmissão depois da Semana Santa, como vimos em muitos países, por as festividades de Navidad, por el carnaval y otros. O sea, donde se baja la guardia y están las condiciones para acelerar la transmisión, el virus aprovecha esas oportunidades y empieza de nuevo a circular con más velocidad y con más fuerza.
Gracias, doctor. Siguientes preguntas vienen de Ecuador. Tanto María Largacha como Gisela Rojas de Ecuavisa dicen que en Ecuador la lista de vacunados en la fase 0 no es ni será de conocimiento público y quieren saber si por transparencia hay que hacer públicas las listas de las personas que se han vacunado o si tal vez eso sería violar la privacidad de las personas. Doctor Barbosa, ¿podría contestar?
Gracias. Mire, todas as pessoas têm direito à privacidade. Eu creio que incluso os pacientes, quando se vão a médico ou quando vão a tomar uma vacuna, têm que estar protegidos em sua privacidade. Eu creio que a preocupação do periodista e a preocupação também de muitas pessoas é garantizar que se está cumprindo com a estratégia de vacunação, de vacunar os grupos mais vulneráveis primeiro. Então, eu creio que isso se pode alcançar sem herir a privacidade das pessoas. Eu creio que é muito importante que os países possam compartilhar seus planos de vacunação com a sociedade de maneira transparente. Nós, a OPS, apoiamos a cada país no desenvolvimento de seus planos, hicimos as recomendações sobre quais são os grupos prioritários para vacunar. Primeiro, os profissionais de saúde que têm risco maior de se contaminar porque estão em contato com os pacientes. Depois, vacunar aqueles grupos que têm maior risco de desenvolver formas graves e de morrer por la COVID-19. Os adultos maiores, as pessoas com enfermidades crônicas, como diabetes, hipertensão, doenças cardiovasculares, câncer e outras condições que podem aumentar o risco para essas enfermidades crônicas. Eu creio que é muito importante uma rendição de conta de los ministérios de la salud para a população, para que tenham confiança em la vacuna e em la vacunação. Ou seja, dizer quais são os grupos que se estão vacunando. Isso eu creio que pode garantizar que a solidariedade da sociedade com os grupos de maior risco possam manter essa confiança das pessoas na vacinação. Pero listas públicas, eu creio que não é a melhor maneira de garantizar isso, e sim ter uma informação atualizada e transparente sobre quais são os grupos que se estão vacunando. Gracias.
Muchas gracias, doctor. Tenemos dos preguntas vinculadas con variantes. Una es de Blanca Valadez de México y otra de Mariana Souquet de Efecto Cocuyo en Venezuela. Blanca Valadez dice que sobre las variantes detectadas en California y Nueva York, pregunta cuál es su impacto en la propagación viral, tal vez mortalidad y en la eficacia de las vacunas. Y Mariana Souquet quiere saber, tras la detección en Venezuela de la variante P1 originada en Brasil, dice que diversos especialistas han afirmado que es más transmisible y que puede empeorar los síntomas y la gravedad de la COVID-19, y también quiere saber qué información maneja la OPS al respecto. Doctor Aldilleri.
Gracias, Sebastián, y gracias por esas dos preguntas de México y de Venezuela, yo creo. Sí, escuché bien. Cuanto a las variantes inicialmente detectadas en Estados Unidos, en este momento no hemos recibido de parte de las autoridades del gobierno estadounidense, autoridades de salud, estudios o datos preliminares cuando hay más propagación y mortalidad. Las investigaciones siguen su curso. No son exactamente variantes en inglés variant of concern, variantes de más alta preocupación que tenemos en nuestro radar en este momento. En este momento tenemos 3 variantes de más alta preocupación, que son la variante inicialmente detectada en el Reino Unido, la variante inicialmente detectada en África del Sur y la variante inicialmente detectada en Brasil. La segunda pregunta de Venezuela destaca la variante P1, que es la variante detectada en el estado Amazonas. Y tenemos en este momento varias publicaciones de científicos brasileños, incluyendo de la Fiocruz en Manaus, que nos han apoyado a mejor conocer esa variante, más que todo en los aspectos genéticos, en los aspectos moleculares. Pero en la actualidad, las investigaciones en Brasil siguen su curso cuanto a la transmisibilidad y la severidad de esa variante llamada P1. Para la transmisibilidad, los datos preliminares parecen apoyar la hipótesis de más transmisibilidad, pero eso había también sido descrito por la variante inicialmente detectada en el Reino Unido a partir de diciembre del año pasado. Cuanto a la severidad, no tenemos en este momento estudios finalizados, tampoco datos preliminares que apoyen la hipótesis de más severidad. Es importante mencionar que tenemos varios equipos de la OPS movilizados en varios estados de Brasil para apoyar la respuesta en los estados. Durante el periodo enero-febrero fue más en la parte norte de la cuenca amazónica. Y a nivel para realmente concentrar nuestro conocimiento, es importante mencionar la expansión de la red de laboratorio a nivel regional. México, como Venezuela y muchos otros países son parte de esa red regional de vigilancia genómica que la OPS está coordinando. Venezuela ha informado de la detección de la variante P1 en varios estados de su territorio, pero tal como otros países y territorios que comparten la cuenca amazónica, Colombia, Perú, Guyana Francesa y otros en la lista. Lo que quisiera otra vez destacar, subrayar, es realmente la importancia de conectar los laboratorios de referencia entre ellos y para asegurar compartir información en un tiempo real, utilizando varios socios como la plataforma GISAID, en la cual los laboratorios de referencia a nivel mundial están subiendo su información. Y esperar que la investigación científica nos dé más información cuanto a las hipótesis de investigación. Espero haber respondido a las preguntas de las colegas en México como en Venezuela. Gracias.
Gracias, doctor. Siguientes preguntas. Tenemos 2 preguntas, una de Ariel Bowler del Tribune de Bahamas y otra de Claudia Rebasa de CNN en español, vinculado con las vacunas en la lista de emergencia de OMS. Ariel Bowler pregunta en inglés, Johnson & Johnson has submitted for emergency use listing to the WHO for the investigational single dose. Has WHO given the seal of approval for this vaccine and PAHO's thoughts about that? Y Claudia Rabasa de CNN en español, también en inglés, pregunta, when do you think there will be a revision for China's Sinopharm and Sinovac vaccines by the WHO? Doctor Barbosa, ¿podría contestar?
Yes, thank you for this question. The Johnson / Johnson & Johnson vaccine has submitted the full dossier to WHO. So this is the review process is in progress. This is a joint assessment between the WHO pre-qualification team and the European agency, the EMA. we expect that until next week, this process will be completed. So this will be good news because we will have another producer, Johnson Johnson has already committed vaccines to COVAX, but these vaccines will be available probably late June or early July. But it's good news because it's another producer that will provide many doses to COVAX facility. And we expect soon to have this process completed. The two Chinese producers, Sinopharm and Sinovac, they started the process. With these producers, the process will take more time because they are new producers. They don't have any previous vaccine for other diseases that were pre-qualified by WHO. So the process had to start from the first step. WHO sent a mission to China to perform an inspection in both producers. This inspection now is completed. Sinopharm has already presented the dossier. Sinovac is still pending some information. But the idea is to receive the dossier to make the assessment as WHO pre-qualification team is doing with all producers, and maybe by the end of March or April, we will have this process completed. It's important to highlight that it's not only WHO that needs to expedite the process. Sometimes the WHO pre-qualification team needs more information from the producers, and they ask the producers to provide this information in order to assess the safety and the efficacy of the vaccines. So it's the WHO pre-qualification team is working on this, and all producers are welcome to present their data, because this will represent that we will have more producers delivering vaccines through COVAX mechanism. But they need to comply with exactly the same criteria to ensure safety and efficacy. Thank you.
Gracias, doctor. La siguiente pregunta que nos llegó viene de Noel Pérez Miranda, de Artículo 66 en Nicaragua, y dice que el Ministerio de Salud ya inició a vacunar con las dosis de Sputnik V donadas por Rusia. Sin embargo, dice, el gobierno hace firmar un documento donde desliguen cualquier responsabilidad a la entidad sanitaria, y pregunta cuál es la opinión de la OPS al respecto. Doctor Aldiguieri.
Sí, muchas gracias por la pregunta de Nicaragua. Cada país, cada ministerio puede tomar una decisión en aspectos relacionados a la responsabilidad de la entidad sanitaria durante la campaña de vacunación de COVID-19. Sin embargo, el uso de este tipo de documento no es parte de las recomendaciones de la OPS en un contexto de servicios de salud altamente afectados por la pandemia. Eso podría impactar en la logística y la agilidad del despliegue de la vacuna. Lo que queremos es facilitar, conjuntamente con los ministerios, es un despliegue rápido y eficiente para lograr coberturas suficientes en personas con factores de riesgo y en zonas remotas y en zonas complicadas. Nicaragua tiene una larga historia cuanto a la implementación de un programa ampliado de inmunización eficiente, incluyendo en las zonas más remotas del país. Nicaragua ha preparado un plan de despliegue de las vacunas que van a llegar a través del mecanismo COVAX con todos sus componentes: cadena de frío, sistema de información, farmacovigilancia, etc. Y quisiera mencionar que el equipo OPS en Managua está trabajando de manera muy cercana con el Programa Nacional de Inmunización del MINSA y con los CILEIS. Espero haber respondido a las inquietudes del periodista en Managua. Gracias.
Muchas gracias, doctor. La siguiente pregunta en inglés viene de Paula Dupras Dobías del The New Humanitarian. Dice, how long will it take for indigenous people in the Amazon, where the situation has been dramatic regarding the pandemic, to be vaccinated? I understand, she says, that indigenous leaders from the region will be meeting with PAHO next week. Should the communities receive vaccines through COVAX? Dr. Barbosa?
Thank you for this question. The vaccines through COVAX are being deployed to the Ministries of Health. And the Ministries of Health in every country have established their national immunization program with the strategies, with the priority groups. PAHO has worked with the indigenous people. Since last year, we had many meetings in each country. We had sub-regional meetings. We had a high-level regional meeting calling the attention for the specific needs of this vulnerable population that we have in our region. We recommended that in some countries, the indigenous people should be part of the priority groups. And we received some national immunization plans that have included the indigenous people among the priority groups. So this is very important, especially the indigenous people that live far from health centers that have limited access to vaccines. Some countries are organizing missions to deliver the vaccines to them. This is important. Of course, we have limited access. The situation in each country is different, but this population should be included in the priority groups because they are more vulnerable due to the conditions that they live and the limited access that they have to health services. Thank you.
Muchas gracias, doctor. Y ya estamos llegando al final de este media briefing y tenemos una pregunta de Ariel Bowleg del Bahamas Tribune. En inglés dice, with COVID-19 vaccines, are countries out of the woods and return to some level normality pre-COVID? What challenges we still face outside of vaccines, and what's your message to governments on managing their expectations? Dr. Etienne?
So thank you, Sebastian. Thank you, Ariel, for this question. As we have noted, the COVID pandemic is the worst public health crisis of our lifetimes. This morning, I told you that in our region, more than 1.2 million people have died, and more than 52 million have been infected. What we do know is that countries took and are continuing to take unprecedented measures to protect their people from becoming infected and overwhelming their health systems. But the truth is that some of these actions have severely impacted our economies. And we made the relationship before with health and the economy. So as we said, no country is out of the woods when it comes to the COVID-19 pandemic. We all remain vulnerable to getting infected. So yes, 40 countries in our region have introduced COVID-19 vaccines, but we will need more time and more doses to reach the millions of people who want to be protected against this disease. So really, we believe that it will take us a long time to reach and return to normality. And we're not sure how long it will take or really what that normality will look like. Until a majority of our population are vaccinated, we urge you, we need to maintain the public health and social measures that are in place that can help us control the spread of cases. So it remains urgent to continue these public health measures, including social distancing, wearing of masks, and washing of hands often. And countries should continue to test, isolate, trace, and quarantine. And even if countries relax restrictions, people must remember the 3 C's. Avoid closed spaces with poor ventilation. Crowded places with many people nearby should be avoided. And close contact settings such as close-range conversations should be avoided. Let us all come together to ensure that we can see the end of this pandemic. But it is only by ensuring that we take those public health measures, that our countries continue to exercise the public health measures that we know work. And with this, we will get to some semblance of normality, but this is going to take time. Thank you.
Muchas gracias, doctora Etienne. Ahora sí, entonces hemos llegado al final de la sesión de hoy. Recuerden que pueden encontrar más información en la página web de la OPS y seguir en contacto con nosotros por correo electrónico. Muchas gracias nuevamente por acompañarnos y recuerden, como dijo la doctora Etienne, sigamos cuidándonos. Hasta la próxima semana.